Okay, hello students. So today I'm gonna demonstrate how to do sterile gloving. And remember that before we put on the sterile gloves, we need to do a clinical hand wash. So I'm gonna open this one because I'm gonna put it in my table here. But before I put it here, I need to do my social hand wash. Yes. And now I can wipe this table. So I'm just gonna grab my wipe here. Because this is sterile, so we need to put that glove in something that's a clean environment. Okay, so I'll just put this back, and this goes into the rubbish bin. And now I'm going to do my social hand wash again. And now this is ready to go in here. So I'll grab it, put it here. I need to get rid of my hazard. So I'll put it back here in the rubbish bin. And now, before I do my 1 minute hand wash, I need to set this up first. So when I set this up first, left should be here, right should be here, and the label will tell you. Okay? And now, I'm ready to do my 1 minute clinical hand wash. So I'm gonna go to this sink and no jewelries, no watches, bare below the elbow. So this is a 1 minute wash. So I'm gonna let this one run because I need to wash my hands. And when I'm washing my hands, fingers on the top, okay? Because by gravity, if I do it like that, all the bacteria will flow down, okay? So I'm going to ensure that my fingers are up. And I'm gonna do this for 1 minute. So you have already learned how to do a social hand wash, that's 30 seconds. A clinical hand wash is for 1 minute. And you can put in more soap as needed. So there's another kind of hand wash, it's called the surgical hand wash, and that goes for 15 minutes. But this clinical hand wash, we do this in the bedside when we're gonna be doing nursing procedure, and we always need to make sure that we clean up to our elbows. So you only clean from your elbows once you have cleaned your fingers properly. And now I'm gonna wash. So when I'm washing, fingers up, and I just slide it so that by gravity nothing will go to my fingers, and I need to make sure that I do not get in touch with this one. And I'm gonna do the same to the other side. Okay. Now when I'm happy, I just need to close this one. There are two ways. I can either use my elbow, or if I don't wanna use that, because some sink doesn't have this kind, I can just grab paper towels, wipe from the tip of my fingers, and I can grab more. And once I'm happy, I will continue wiping down. So I've used this side to wipe this, so now I can use this side to wipe my other hand. And if you're using a sink that you can turn, you can use the paper towel that you wiped to close it. But for this one, it's just the elbow close, but I can use this paper towel here. Now I am clean. Okay, I've just done my clinical hand wash. To make sure that I do not contaminate any part of my hand, I need to do my prayer. And when I'm praying, my hands needs to be away from my clothes and away from anyone. So now we're gonna go back to the bedside. Okay, so before I touch that, remember that I've used a paper towel to wipe my hand with. That is clean. So now I need to do my second hand wash, and I'm gonna use this alcohol wipe. Okay, now I'm ready to touch this one. So the principle of sterile gloving is that it's glove to glove, skin to skin. So once I'm opening this one, I can only use this flap to open it. I am not allowed to touch any area here. I can just touch this. So 2 centimeters away is dirty, and everything 2 centimeters within is sterile. So now this is left, this is right. It doesn't matter which one you pick up first. Just make sure that it's comfortable, whatever you're picking up, whether you're starting with your left or right. Make sure that you're comfortable doing it. So I can only touch this part of the glove. I am not supposed to touch this one because this one is gonna be the one in contact with my skin. Okay, so we have the left and the right. So if I'm gonna put my left glove first, I'm gonna use my right hand to pick it from here. And you can see that the thumb part is in this side. It follows the anatomical structure of the hand. And I just slide it through. I can put it up just so making sure it doesn't get contaminated. And I let go. So now this sterile glove cannot touch this part which is going to the skin. It can only touch the sterile part of the outside glove. So now, so that I can put my finger in my hand inside, I can use these two fingers to go into the sleeve here. So if you can see that, it's in there. And now my right hand just follows the anatomical structure of this glove on the way it was set up. You see, I didn't touch any part of the inside of the glove, and I release. So now I am sterile. So my eyeglass is falling off, so I can just use a part of my body which is not sterile to fix myself. Yes, and now I'm ready to go. So question, do I throw this away? This part is sterile. This part is non-sterile and 2 centimeters from the inside. I suggest that you do not throw this away because this has plenty of purpose. Like for example, I can use this so that I can bring my table nearer to my patient, and I can use this as well to grab his blanket, you know, in setting him up for any procedure that we're going to do. And this can also be my rubbish bin once I'm doing my procedure. So the question is, when do we use sterile gloves? When we are in the ward. So when you are doing chest drain, pulling out of wound drain, when you're doing wound irrigation, complex dressing, and when you're doing the IDC insertion. But ENs are not allowed to do IDC insertion. It's only RNs, okay? So for this skill, it's just donning of sterile gloves and clinical hand wash, and these ends are clinical skills. Thank you.